So good evening and welcome to the NYC Health and Hospitals Fiscal Year 2025 Annual Public Meeting for the Borough of Queens. Before we start the formal program, I would like to call to your attention that we have language translation service available in Bengali, Spanish, and French Creole. If you require these services, please call 212-788-3359, 212-788-3359. Thank you. So my name is Jose Pagan. I'm chair of the NYC Health and Hospitals Board of Directors, and I want to thank you for joining us, and would like to introduce the other board members who are participating. So we have Karen Sanhilier representing Molly-Wasso Park, Dr. Patricia Martone, City Council Representative for Brooklyn, Dr. Mitchell Katz, President and CEO. I would like to recognize New York State Senator Leroy Comrie of the 14th Senate District, and Elizabeth Sowunmi, Deputy Chief of Staff, representing Senator Comrie's office. Thank you for participating in a listening capacity. Also on the panel, Andrea Cohen, Senior Vice President and General Counsel and moderator for the evening, and Colicia Hercules, Secretary of the Corporation. So on behalf of the board, I would like to extend our thanks and acknowledge leadership at our Queens facilities, Helena Arteaga Landaverde in Elmhurst and Neil Moore in Queens. Thank you. And their dedicated staff for providing exemplary service to our public health system and the people that we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. So now I turn the microphone to Dr. Katz, our President and CEO.
All right. Good evening, everyone. I'm the proud President and CEO of New York City Health and Hospitals, and I'm a practicing primary care doctor. This is my eighth year here at the health system. It's an amazing place, Health and Hospitals. There's never been an organization with a bigger heart. I want to thank the board members who are here and the staff members who organized this, and especially those of you in the audience. Thank you so much for coming. My goal has always been to expand access to care for New Yorkers, regardless of their ability to pay or immigration status, to offer the highest quality of care and advance our mission and values. Before we begin tonight's meeting, I want to highlight some of our achievements. Nursing had a phenomenal year. We hired over 3,600 new union nurses since March 2023 to decrease our reliance on agency nurses, and the great CNO of Elmhurst is right there in the front row, and we thank you for your efforts. A huge number of nurses. We housed over 375 of our own patients through our Housing for Health initiative, which is now housed over 1,200 patients. We continue to be a leader in LGBTQ care. We reached a milestone of performing 200 gender-affirming surgeries. All 18 of our facilities earned the LGBTQ plus healthcare equality leader designation, which we are very proud of. Our groundbreaking lifestyle medicine program completed its expansion this past year, opening new sites at Elmhurst Hospital, Gotham, Vanderbilt, and Lincoln Hospital, where we're able to help people through changes in their diet, in their exercise, in their sleep and stress reduction, to make major changes in their health. We have expanded our behavioral health services so that we can provide better for all of New York City, including a loan repayment program for our staff, thanks to some very important philanthropic donations. We're very proud that we have provided services at our Asylum Seeker Arrival Center, which has welcomed now more than 175,000 individuals from more than 160 countries. New York City Care, NYC Care, our health access program for people who can't afford or are not eligible for insurance, is now up to 125,000 members. We've opened 20 new wellness rooms. Our arts and medicine programs continue to beautify our facilities. Our 250 community health workers have worked with over 25,000 of our patients. And we launched our own podcast. In more specific acknowledgement of the amazing things that are going on in Queens, the Elmhurst was named the U.S. News and World Report Best Regional Hospital, high performing in 6 specialties and high distinction in maternal care. Elmhurst became the first American hospital to form an alliance with the EHL Hospitality Group to enhance patient experience. The hospital participated and hosted 281 community events. Helen, who is up here, received the prestigious Joan H. Tisch Community Health Award, and we're very proud of Helen for all her accomplishments, including getting her PhD this year. The hospital completed several important capital programs. Queens Hospital, sitting next to Helen, is Neil Moore, who's a wonderful CEO for our Queens facility. They opened 2 new clinical programs, including weight management and primary care for behavioral health patients. The emergency department received the Emergency Nurses Association Lantern Award in the spirit of the Daisy Award, which was created for extraordinary nurses. The Touching Unique Lives in Practice Award was established to recognize support staff, and Queens Hospital is the first hospital in the health system to receive the award. Hospital had successful screening days, including for lung, breast, and prostate cancer. It received a leader designation in the 2024 Healthcare Equality Index survey. The survey promotes LGBTQ plus inclusive policies and affirming practices. Queens Hospital achieved a 5-year designation as a National Infant Safe Sleep Hospital. We also want to acknowledge the great work of the Gotham in Queens. Gotham Health Queens and Roosevelt received awards from the American Heart Association Millions Heart Programs for exceeding metrics for hypertension, type 2 diabetes, and cholesterol. And the Queens sites last year were awarded $6 million in capital funding from local elected officials for improvement to sites that will lead to better health outcomes for patients. So we are all very proud of the great work that goes on at Health and Hospitals. And we now really look forward to your input, which is the reason why we're here. We want to hear from all of you. We appreciate that you came out to talk with us, and our general counsel will outline how the rest of the evening will proceed.
Great. Thank you. Thanks so much, Dr. Katz. I'm Andrea Cohen. And I'm going to be with you. We will all be with you for a while this evening. Before I go further, since a few people joined the room, let me just say, we remind you that we do have language translation services available in Bengali, Spanish, and French Creole. And if you need these services, please call 212-788-3359. It's not the translation. Thank you. Okay. So in 2025, the wonderful borough of Queens is hosting the first in a series of 5 meetings that we conduct annually every year across the city's 5 boroughs. The purpose of the Health and Hospitals annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, as Dr. Katz just outlined. And now we move to the part of the program where we afford the public an opportunity to present oral or to submit written testimony about New York City Health and Hospitals performance. all testimony that we received tonight, and as you know, we have some wonderful board members here to listen to it live, but all of it will be either transcribed or if it's in writing, transmitted to the entire board of directors for New York City Health and Hospitals for their consideration. We have registration for testimony. It just ended. Never mind. It just ended at 6:30 p.m. But we have a nice list of speakers for this evening already. So I'll be moderating the balance of tonight's meeting. And I'm just going to give you a moment on the rules of the road. So the first point to understand is that the members of the board are here to listen to you, but it's not a question and answer forum, and they won't be engaging in a dialogue. This is your chance to talk and our chance to listen. We had at last count, but there might be more by now, a whopping 37 speakers registered this evening, which is wonderful and reflects the interest and enthusiasm of the community. And we were still counting at that point, but it's really important that we keep on time. So each speaker will be allotted 5 minutes of speaking time on the podium right here, and right in sight of the microphone is a timer that will give you a sense when you are a speaker about the expiration of your time. It will be green when you begin. When it turns yellow, it will indicate that you have 2 minutes remaining in your time, and then it will turn red. And that will let you know that your time has elapsed. About 10 seconds later, it will start to flash. And at that point, I'll ask you to just finish your sentence. And then you can, and let the next speaker go. But you can always submit more comments if you haven't had a chance to complete them. You can always submit them in writing and we'll consider all of them. But it's just very important. Please do keep your remarks to 5 minutes or less. I will be, we have a microphone here. That's where the speaker should come. I will call a speaker and give their affiliation, but I'm also going to give the name of the next person on the list so that you can move yourself into position or be ready to go as quickly as possible between speakers. I apologize in advance if I mispronounce any names. Please correct me if I do, and let us know your name correctly. Thank you so much for your participation in advance. It's really so great to have such a long list of people interested in engaging with us, and we will now get started.
Tener como ustedes pueden hablar, si alguien quiere hablar en el español o en el idioma que quiera, puede hablarlo. Las líneas van a quedar, alguien va a traducirles si ustedes hablan en español, ¿ok? Pedimos disculpas. Además, el Bluetooth de hacer el traductor no se puede conectar para hacer una traducción. Pero les agradezco. Su voz es muy importante para.
Okay. Gracias. Okay, I think our first speaker today is New York City Council member Lynn Schulman.
Hi, I'm Council Member Lynn Schulman. This is not my district, but I represent the district just adjacent, which takes in Forest Hills, Kew Gardens, and Richmond Hill and part of Rego Park. A lot of my constituents come to Elmhurst. I actually grew up in Elmhurst. I was born in Elmhurst, not in Elmhurst Hospital, but I was born in Elmhurst. And I have been a consumer of the hospital, so I'm very happy about that. And I have been in government for a very long time and know all of the predecessors to Dr. Katz and to Helen Ortega. And I want to tell you that they're two of the best people that you have. Mitch Katz made H&H, used to be HHC, but H&H viable, financially viable, which is amazing. And nobody ever thought. So okay. So, and Helen, I knew the predecessors to Helen Ortega, and she's really made this hospital more amazing than it was. And she's modernized it and brought in a lot of staff and great people and all of that. And I've not only had good care here, but caring people who took care of me. So I was very, very happy about that. And thank you, Helen. I am the chair of the Health Committee also. So as chair of the Health Committee, I am part of the program called Healthy NYC, which Dr. Katz is very involved in. I codified that in the city council so that we can extend people's life expectancies and work on the 7 drivers of premature death, which are cancer, chronic disease, all of that. I passed the first citywide plan to reduce diabetes, type 2 diabetes, the impact. And I also was, I had a number of pieces of legislation around maternal health and children's health and senior health and all of that. So this hospital is really amazing. Like I said, I'm a consumer, continue to be a consumer, and I appreciate everything that everyone does. And thank you to the board for having this meeting here. Thank you.
Thank you. Thank you. And I didn't do what I said, what I would do. The next speaker will be the Honorable Edwin Novillo, the supervising judge of Queens County Criminal Court. And after that, the next speaker will be Raj Punjabi. Thank you.
Those of you who don't judge, but more as a member of the community. You know, having had the privilege of growing up just a couple of blocks away from the hospital, I know how incredible Elmhurst Hospital is. I've witnessed firsthand how the hospital is not just a healthcare facility, but also a beacon of hope for the community. It's a place where people go to obtain treatment. It's a symbol of care. It's a symbol of compassion. It's a symbol of strength, the place where the hospital in and of itself prides itself in the ability to provide access to healthcare for all members of the community. A place that treats people with dignity, with respect, and with kindness. You know, my parents still live a couple of blocks away, and they come to the hospital whenever they're in need. You know, my family's in the surrounding area, and this is where they come when they're in need of healthcare. You know, it's been approximately 5 years now since the pandemic ended, but during the pandemic, Elmhurst was the beacon of hope, the beacon of inspiration, the beacon of pride of our community, right? Everybody who got sick came to this hospital for the help that they needed. Many of their loved ones passed away, and it was in this hospital that provided them with the comfort that they could at that time. Now, having been 5 years into the pandemic, you now have an amazing person and someone who I consider, and I'm honored to call a friend as your CEO, Helen Arteaga. What an incredible person to lead Elmhurst Hospital. I couldn't imagine a better person to lead the hospital. Under her leadership, this hospital has emerged stronger and more resilient and more connected to the community than ever. Just a few months ago, I sat in a room upstairs where we had a New York State governor for the and not only did the governor visit the hospital, but during her visit, she announced that she was granting Elmhurst Hospital $27.5 million to expand the maternal and pediatric healthcare. I mean, that's extraordinary. And I'm confident that such an extraordinary accomplishment would not have happened but for CEO Arteaga's visionary leadership. It's not easy to get people to care, but that's what Helen does, and that's what she did. She's consistently making efforts to ensure that the hospital has the resources and the care it needs to remain a place of hope and compassion and excellence. So thank you, Helen, for all that you did and for all that you do to make Elmhurst Hospital stronger than ever before. Thank you.
Thank you.
Thank you very much. The next speaker is Raj Punjabi, Community Advisory Board Chair for Elmhurst Hospital. And after that, the speaker will be Robin Hogans.
Good evening. My name is Raj Punjabi, and I'm chairperson of NYC Health and Hospital, Elmhurst Community Advisory Board. I would like to thank the hospital and its staff for life-saving work they have continued to perform each and every day. This evening, I wanted to share with you some valuable information that highlights all the hard work the staff of Elmhurst have done over the past years and is still doing it, despite the stresses and strains placed on the hospital daily. For instance, this past year, Elmhurst Hospital treated close to 800,000 people in its outpatient clinic. Great job. Has consistently had one of the busiest emergency departments in the nation, delivered 2,636 babies, and admitted over 19,000 people for care. The hospital also received a well-deserved honor when it was nationally ranked by US News and World Report as one of the America's top hospitals for the treatment of patients in 6 categories, including heart attack, orthopedics, hip fracture, kidney failure, and heart failure, along with high distinction in maternal care. In addition, the hospital was also named a best hospital for equitable access for the quality care it provides. As a community member, I have been excited to hear about the many improvements and construction projects that are slated to begin soon, including the renovation of hospital's labor and delivery unit, emergency department, and front entryways. All good achievements because of our CEO. I want to thank all of our Queens elected officials for their deep investment in Elmhurst and want to especially thank Governor Kathy Hochul for allocating $27.5 million this past year to provide Elmhurst with a new pediatric intensive care unit and comprehensive women's health center. I'm proud of our doctors, nurses, and extended care team who are deeply committed and work hard has made these achievements possible. I hope that we can count on NYC Hospital and hospitals to support the ongoing quality services that Elmhurst Hospital provides to our community. As it is very rightly said, positivity, vision, and enthusiasm are very important part of any organization. And this is what our CEO, Dr. Helen Atigia, and her team, Medical Director, Dr. Laura Livakoli, Chief Nursing Officer, John Gull, Chief Operating Officer, Milanko Milinik, and the rest of the hospital leadership and the staff are committed to our community, which greatly needs and deserves the outstanding medical care that has been provided to over past years. Thank you.
Thank you very much for your comments. Next speaker is Robin Hogans, the Queens Community Advisory Board Chair. And after that, Carla Leon. Oh, I'm sorry. Robin is not here. The next speaker is Carla Leon from the Elmhurst Community Advisory Board. And after that is Courtney Fenton.
Hi, good evening all. My name is Carla Leon, and I am a member of the NYC Health and Hospitals Elmhurst Community Advisory Board. I would like to read a brief statement on behalf of GROW NYC, the CBO that runs Elmhurst Hospital's Green Market from June through November. The Green Market couldn't send a representative this evening, but wanted to express to the Health and Hospitals Board how valuable Elmhurst Hospital is as a community partner. GROW NYC Elmhurst Hospital Green Market Testimonial. GROW NYC is thankful to the Elmhurst Hospital CEO, Board, WIC program, and administration, especially Ms. Atia Butler, for their ongoing support of the GROW NYC Elmhurst Hospital Green Market. It is our hope that this farmers market not only provides essential access to fruits, vegetables, but also serves as a gathering space where the community can connect with neighbors, colleagues, and engage in healthy lifestyle initiatives and programming. We're excited for another season of bringing locally grown farm fresh produce to the community, while also supporting individuals shopping with SNAP, EWIC, and WIC, and Senior Farmers Market Nutrition Program benefits, who are looking to provide nutritious food for themselves and their families. This past season, the Elmhurst Hospital Green Market performed $45,000 in SNAP sales and $3,200 in Health First OTC sales. The Elmhurst Hospital Green Market returns June 10th and operates every Tuesday through November. Looking forward to seeing you all there. Thank you.
Thank you so much for your comments. Next speaker is Courtney Fenton, third vice chair for the Queens Community Advisory Board. And after that, Maxine Allen Brannon.
So I have to come down.
Sorry. You may be able to raise it up. Want to try to raise it up? Or you could pull the microphone right out from that. Thank you.
Oh, okay.
Thank you.
Okay, thank you. Good evening, greetings to all. My name is Courtney Fenton, and I'd like to give you a small background about myself. I am also I'm a union representative for DC 37. I am assigned to cover all of the Brooklyn and Queens Hospital District. I am also a member of the Queens Community Advisory Board. I am also a proud Jamaican who came to the US at a young age. Since we are recognizing Black History Month, I would like to give a quick history of Jamaica and the various Caribbean islands. Many Africans were taken from their native land. They were various tribes. One of the tribes were known as the Ashanti tribe, who were fierce warriors and was dropped in a various island because of their rebellious ways. While Jamaica motto is out of one, there are many. I'm also a proud second generation cousin to Marcus Garvey. He is considered the first activist who fought for justice and dignity, which continue to guide us, especially now. As we reflect on President Biden's harmonious pardon, a reminder that progress through delay is possible. Tonight I ask, how do we honor that progress when there are some people who are trying to take away our history? Some states are taking various books out of our libraries and schools. Tonight I ask, how do you honor the progress while upholding or duty to heal without fear? I begin by recognizing the steps of leadership has taken the clarity ICE protocol, such as documentation and escalating issues to the immigration liaison, and prioritizing patients' safety within the law are critical safeguards. To the board, let us continue to build these foundations, providing training that transform compliance into clarity with legal experts to know how to ask for warrants and contact the immigration liaison without hesitation. Ensure no one faces retaliation for following protocol when ICE comes to facilities for undocumented immigrants. My fellow workers, you are not alone. DC 37 will ensure every member knows that their rights. We'll distribute refreshing materials in English, Spanish, and Creole. Stand with you as you uphold both the law and our mission. The Black History Month, we honor leaders who proved progress, lies, partnership, DC 37, 1199, SEIU, NISNA, and others are collaborating with the hospital Black History Month Committee for the panel on February 27th. And here how it works. Each union will honor a trailblazer from their history, a leader who expands workers' rights through advocacy in their name. They will present all awards to a Queens Hospital employee who embodies that legacy today. Imagine a social worker ensuring language access, a nurse advocating for equitable care, or a clerk documenting disparity. These honorees prove integrity and compliance coexist. This is about nostalgia. It's about lighting the path ahead. Marcus Garvey once said, the end you serve are for all, while which will take you into eternity. Together we can make the vision real. Thank you.
Thank you.
Thanks for your comments. The next speaker is Maxine Allen Brannon, a Community Advisory Board member from Queens Hospital. And after that will be Quentin Mezitin.
Good evening, everyone. Thank you for the opportunity to speak. I'm Maxine Brannon. Tonight, I stand before you not just as a member of the Queens Community Advisory Board, but as a witness to the transformation power of leadership that prioritizes people. Under CEO Neil Moore's direction, New York City Health and Hospital Queens has become a case study in how investing in staff and staff wellness isn't a luxury, it's a catalyst for institutional excellence. Let's begin with the fact as of January, 39% of our staff had completed the I Care with Kindness training, and 48% have signed pledges to uphold service excellence standards. These metrics matter, but what matters more are the stories behind them, the tangible steps that this hospital has taken to ensure our caregivers feel seen, supported, and empowered to do their best work. Take wellness programs, weekly chair yoga, and meditation centers give staff tools to decompress during grueling shifts. The H3 Wellness Team, Samba classes ignite energy and camaraderie, while a separate group of employees has taken initiative to organize a soca workout session, a grassroots dance fitness program that's become a highlight of the week. Additionally, our monthly open art session led by professional art therapists offer a space for creative expression, helping staff process the emotional complexity of their vital work. Then there's the Music for the Soul, a partnership that makes it possible for Grammy-winning artists to perform at our hospitals. These concerts do more than entertain. They remind staff, patients, and families alike that healing thrives in spaces where joy is intentional. Operational changes are equally critical. The newly launched Fresh on the Go Cafe, with an online ordering system, was a direct response to staff pleading for shorter lunch lines. It's a small fix with outsized impact, preserving precious minutes for staff to rest and recharge. This spring will debut another Driven Win, a rooftop retreat. Can't wait for that one. What was once an overlooked and unused space in a new vibrant oasis, complete with murals, greenery. It's a testament to leadership, willingness to listen. Staff asked for sanctuary at the hospital and they received it. And let's not forget last Thanksgiving, when Resorts World, prompted by Senator Leroy Comrie, brought in over 500 meals to feed all the staff that were working Thanksgiving weekend. To CEO Neil Moore and his team, your commitment to operational empathy sets a standard. You've shown that staff wellness isn't a line item. Thank you.
Thank you.
Thanks for your comments. Next speaker is Quentin Mezitin, Community Advisory Board member from Queens Hospital. After that is Malika Carterone.
I tried to study this, but kidding. Good evening. My name is Quentin Mezitin, and I'm honored to be here. I stand before you as the executive board member of the Queens High School's President's Council and the president of Community Education Council in District 28 and D75 representative. Now, I'd like to extend my gratitude to Cleon Edwards for his invitation tonight and to all of you guys for setting this up. Unfortunately, our president for Queens High School's President's Council, Sharnette Walters, couldn't be here to a prior commitment, but she sends her warmest regards and her full support for this event. I would also like to note that Sharnette serves as the PTA president of Queens Gateway to Health Sciences, a role that underscores her deep commitment to fostering connections between our schools and the healthcare community. This evening, I'm here to celebrate and reinvigorate the long-lasting partnership between Queens High Schools and Queens Hospital, a relationship that has always been vital to our community. As we emerge from the challenges of COVID-19 pandemic, this partnership is more important than ever, and I'm excited to share how we've been working to strengthen these ties. As a newly elected council for 2025 school year, we've taken proactive steps to create a direct link between Queens Hospital and 86 high schools across the borough. One of our key initiatives has been sharing volunteering opportunities at the hospital with our students and parents, working directly with the Director of Volunteer Services at Queens Hospital. We've worked closely with parent coordinators and principals to distribute information about how to apply, the requirements needed, and the benefits of these opportunities. Additionally, we've collaborated with Merlene Smith Satilo of the Sickle Cell Awareness Foundation to support and promote their upcoming symposium on April 4th at Queens Hospital, which is open to high school students interested in the medical field. This is just one example of how we've worked to connect our students with meaningful experiences that align with their career aspirations. At our monthly meetings, we've also prioritized mental health and overall wellness by inviting speakers to address these critical topics. We believe that fostering a culture of well-being is essential for our students, families, and community as a whole. Looking ahead, we're excited to explore new pipelines with Queens Hospital to create opportunities for all of our students, both Gen Ed and District 75, to engage with the hospital environment. Whether through internships, job shadowing, or educational programs, we see immense potential in this collaboration to inspire and prepare the next generation of healthcare professionals. Finally, I want to acknowledge the essential role that schools like Queens Gateway to Health Sciences, direct neighbors to Queens Hospital, play in our community. Their dedication to health sciences education is a testament to the power of partnerships like this one. Thank you again for having me here tonight, and thank you for your commitment to this vital collaboration. Together, we will continue to build a stronger, healthier, and more connected Queens.
Thank you.
Thanks for your comments. Next speaker is Malika Carterone, President and CEO of Global 25. And after that is Merlene Smith Sotio.
Good evening. Thank you for having me this evening and for the opportunity to bring remarks. As stated, my name is Malika Carterone, and I'm the President and CEO of Global 25. At Global 25, we like to say, I see. We focus on social justice, economic justice, environmental justice, and educational justice. I am also the former board member of the CAB Advisory Board at Queens Hospital. I served 3 terms as part of the CAB at Queens Hospital. I had the honor to work with fellow board members, hospital administration, doctors, and also hear phenomenal presentations by the administration and doctors pertaining to their cutting-edge research and implementation of much-needed projects and healthcare initiatives. Several of my friends and colleagues credit Health and Hospitals Queens with saving their life. As a CAB board member, I had the opportunity and privilege to implement the first online election. This also brought to the attention of the board and also to the hospital the digital divide. We were able to address telehealth, the density, access to apparatuses, and also the age difference that also impacted using online apparatuses and platforms. Global 25 also partnered with the hospital to host the first Read Aloud in the Pediatric Center. Global 25 also partnered with the hospital, Verizon, during the Mental Health Month, also to bring health and mental health awareness to the staff at all 3 entities, and also to make sure that the constituents were receiving the much needed mental health care that they needed. I also had the auspicious opportunity to work with doctors at Queens Hospital on grants to address food insecurities. I can go on and on and on about the fabulous things that Queens Hospital is doing, but I will close with this. Based on my environmental background, I was also able to ask probing questions as related to environmental impact statements, also to ask questions and question initiatives as it related to ESG, environmental and social governance, as it related to the hospital policies and procedures, and also the governance at the hospital, and the impact that it had on the surrounding community. Global 25 also had the opportunity to partner with Elmhurst Hospital as it relates to their doula program and doula initiative. This was very personal to me because my great-great-grandmother was a baby nurse and also a midwife. This led me to be able to participate in the VIBE study. Again, I could go on and on about the fabulous work that the hospital has been doing, but it's been my honor to serve and work with the hospital. Global 25 looks forward to continuing to work with the hospitals to implement much-needed services to address the medical needs of the constituents they serve. And again, thank you so much for the opportunity to bring remarks this evening.
Thank you.
Thank you so much. Next speaker is Marlene Smith Sotillo, President and CEO of the Sickle Cell Awareness Foundation Corp. And after that will be Raida Hossein.
Well, good evening, everybody. Good evening.
Good evening.
I am Marlene Smith Sotillo, the president of the Sickle Cell Awareness Foundation Corp. International, a mother and a partner in this hospital's mission to transform care. Tonight, I am here to celebrate the collaboration that turns pain into progress. Years ago, we held a rainy 5K walk run in memory of my son, Sid, who lost his battle with sickle cell disease. That day, my daughter, who also suffers from sickle cell, was there. Our community showed up, friends, leaders, and advocates, proving that even in storms, we march forward. For 15 years, our organization has worked with Queens Hospital Center to bridge gaps in care. We have educated families on sickle cell, linked to heart and kidney disease, championed laws to end this bias in pain management, and partnered with heroes like Dr. Pollard, whose pediatric research saves lives here every day. Dr. Marcy Stein Albert, whose pioneering work in transcranial Doppler screening and hydroxyurea therapies has prevented strokes and transformed care for children. And Dr. Kenneth Revlin, whose adult hematology protocols set national standards. Last month, our Committed to the Cause Gala, we honored leaders like Mr. Neil Moore and our surgical nurse, Linda Ballone, bridging gaps in research and compassion. I was also privileged to deliver congressional certificates from Congressman Gregory Meeks to our administrative staff, unsung heroes who work tirelessly behind the scenes. Born in Trinidad, I never imagined leading a movement. But when my children were diagnosed with sickle cell, I saw the cracks in our system, delays, dismissed, and silenced. So in 2007, I founded this organization. Today, we offer genetic counseling, crisis support, and advocacy, standing with partners like NAACP and 1199 SEIU. Sickle cell impacts more than 100,000 Americans, yet 2.5 million carry the trait unknowingly. Children face strokes, adults endure organ failure, but progress thrives here. Early screening, breakthrough therapies, and our annual toll drive, bringing joy to thousands of children last holiday. Healing demands more than seasonal kindness. It requires partnership, turning despair into dignity. My son used to say, advocacy is love in action. Let's keep acting. Honor pioneers like Dr. Revlin and innovators like Dr. Stein Albert. Celebrate everyday heroes like Linda Ballone, and let every patient know you are seen, you are heard, and you are never alone. Thank you, the Queen's Hospital. Together, we'll conquer sickle cell. Thank you kindly for your time this evening.
Thanks so much for your comments. Next speaker is Raida Hossein, Community and Government Affairs Liaison from Live On New York. And after that is Laura Jean Hawkins. Raida Hussein. Laura Jean Hawkins, Advisory Board Chair for Sharing and Caring. And after that is Anna Krill.
Hello, my name is Laura Jean Hawkins. I'm a Queens resident of almost 6 decades. I grew up in Sunnyside, Queens, and throughout my life, Elmhurst Hospital was always part of the fabric of growing up in Sunnyside. My parents utilized the services of Elmhurst, as did many of my friends and neighbors. In fact, I remember the old Elmhurst Hospital. When I was 15, I worked at a Greek coffee shop on 74th Street and Roosevelt Avenue, right down the block. And I remember when they started construction to expand the hospital into what it would become today. I'm also an advisory board member of the CAB. I'm a CAB member of Elmhurst, and I am the advisory board chair of Astoria Queen Sharing and Caring, which is a Queens-based cancer organization celebrating 31 years of service to the cancer community. In partnership with Elmhurst and Queens Hospital, we have worked to educate men and women about cancer education and health and wellness. Over 30 years ago, Queens County did not have any services. If you were diagnosed with cancer, you would have to leave the borough. Through the work of the late and great Claire Shulman, our former borough president, the Queens Cancer Center was built. And in partnership with the Queens Cancer Center, we were able to bring the mortality rate, which at that time was 4 times the national average in Queens County, on par with the rest of the nation. So I'd like to stand here today and thank the leadership of Elmhurst and of Queens Hospital, as well as their amazing professional medical staff, for their commitment and dedication to the health and welfare of the Queens community. Thank you so much to all of you. In both of my roles, I've worked closely with both hospitals. But I want to give a special shout out to the wonderful staff of the Queens Cancer Center, which is truly a comprehensive cancer center in New York City throughout the H&H system. It offers everything from diagnostic testing to treatment to social services, to even its food pantry, because food insecurity is such an issue for people dealing with cancer. So thank you, Mr. Moore. Thank you to Dr. Kemeny, the former director of the Queens Cancer Center, and its new director, Dr. Ellen Hagopian. And Dr. Katz, in your remarks, you did not mention the Queens Cancer Center, so don't forget that jewel within your system.
Agreed.
I'm here today to urge the New York City Health and Hospitals Board to consider that in Queens County, our medical professionals, and at the Queens Hospital, our medical professionals are not paid what they should be getting paid, especially oncologists. There is a disparity that exists. We need your help to resolve that disparity, because anything else would be a disservice to the cancer community and the residents of our borough. I'd also like to urge you to consider that over the course of the next year, every hospital within the New York City Health and Hospital system that provides chemotherapy to have on site the ice scalp cooling devices. Because as you know, the governor signed a new law, the first in the nation, that would require private insurance carriers in New York State to cover that treatment. Cancer takes so much from people, it shouldn't have to take their hair. And you have the power to make sure those devices, which are covered under Medicaid, Medicare, and now in New York State under private insurance, as an option for people battling such a serious illness. Help them save their hair, help them keep up their spirits so that their outcome will be a healthy and successful outcome. Thank you.
Thank you very much. Next speaker is Anna Krill, the founder and president of Sharing and Caring. And after that, Mariana Lopez. Good evening.
Good evening, and thank you so much for inviting me to share my experience with our Queens Health Network here and our public hospitals. First of all, the public hospital system is very dear to me. I was born at Bellevue, but most importantly, I am also a 2-time breast cancer survivor. I want you all to know that in 1994, I joined the Elmhurst Advisory Board and served on the board. And then in 2007, until 2016, I was an HHC board member. So now let me share with you what is the most important thing? Not only am I a community person and I run a wonderful breast cancer organization, I'm also a patient of our hospitals by choice. I came when I was diagnosed the second time, which was in 2020, during our pandemic. I was seen here at Elmhurst, given a biopsy to confirm I had breast cancer again. I then opted to be treated in the caring and most expert hands of Dr. Margaret Kemeny. I also have to say that the gem of cancer treatment truly is the Queens Cancer Center. They provided me with the support and the state-of-the-art treatment that was required for me to be able to be here tonight to tell and share my story with you, my experience with our hospitals. The dedication, the profound dedication and service that is given to each and every patient is truly remarkable. Your empathy, their empathy, our staff is remarkable. Their empathy, their expertise, their caring spirit and dedication. And we know, as Laura Jean mentioned, they are underpaid, but they do it because they care. They care about their community, and they should be recognized for that. I have to also personally thank Linda Bulone. We talk about the ice cap treatment. I had to get chemotherapy, and I truly dreaded it. I didn't want to lose my hair. For a patient, when you have hair loss, for myself personally, it is a reminder every single moment of every day that you are fighting for your life. If you do not need to be reminded of that fact continually, if you don't have to feel isolated because you don't look well, then, it should be something that you have a choice to either get the ice cap, retain your hair, as you could see I did, and move forward. Get your treatments and move forward with the encouragement, of course, of every member of the cancer team. So I have to thank, like I said, the Queens Cancer Center. And I want you to also give them the support that they need so that we can have the best physicians there and the best nurses, that they will be able to serve the community very well. Sharing and Caring was born as an outcome of my first diagnosis in 1993. We had no services in Queens County to support cancer patients. But what happens is we also realized there was a very huge lack of information about cancer, information about early detection, can have a very positive outcome in treatments. So we actually formed a partnership with our Queens Hospital network, with Elmhurst and with Queens Hospital, to start to do community outreach. We wrote the book on it, and we are the best at it. And we have, from 4 times the national average high of our mortality rates, to now where we are even nationally with mortality rates, and cancer treatment and diagnosis is a pretty good, I think, indication that community outreach truly is very effective. And it cannot be done by a CBO only. It must be done in partnership with the providers who are expert in that field. So it's a partnership, but that partnership saves lives. And we're out in the community, and we know our members, and we're very, very effective in what we do. So I want to thank you again. I will urge you also, as a chemo patient, to please also provide hot meals for your chemo patients versus the little cold snack due to the high food insecurities that they presently are facing. And also, please make sure the ice caps are available. Thank you very, very much. And again, thank you to
for your
the leadership of our hospitals.
Thank you. The next speaker is Mariana Lopez, CEO of Life Skills Counseling Services, and after that, Antonio Alarcon.
Hello, good evening, everyone. Thank you very much for inviting me to this meeting. So my name is Mariana Lopez. I'm the CEO of Life Skills Counseling Services and the Executive Director of Centro Comunitario Hispano, a nonprofit organization. And I also work as a mental health consultant in different preschools in Queens and Brooklyn. So just want to read from here. At our outpatient mental health clinic, we see many individuals struggling with anxiety, depression, trauma, and family stress. A large part of our Hispanic community relies on Elmhurst Hospital in their healthcare needs, including mental health services. Mental health care is not a one-size-fits-all approach. While we provide therapy and support in our office, some clients need a higher level of care, and that happens all the time. And since we are here in Queens, so we rely on Elmhurst Hospital. So therefore, their role is very crucial. We share many clients with Elmhurst. When someone needs psychiatric services, crisis intervention, or medication management, we refer them to the hospital, knowing they will receive the best help they need. Many of our Hispanic clients trust Elmhurst as their go-to hospital. Having their partnership ensures that they will get comprehensive, cultural sensitive mental health care, both in crisis situations and for long-term recovery. By working together, we create a full system of support. Our parenting program helps to improve family relationships. Our outpatient services help individuals heal and rebuild their lives, while Elmhurst Hospital provides critical psychiatric cares when needed. So this collaboration strengthens our community and saves lives. Thank you very much, Elmhurst Hospital, and to the CEO, Helen Arteaga. Thank you.
Thank you.
Thanks so much for your comments. Next speaker is Antonio Alarcon, Senior National Organizer and Community Member. After that is Bill Soros.
Good evening, everyone. Buenas noches. Buenas noches. We need some coffee in here. I will do it bilingual. I know some people in the White House don't believe in DI, but in Queens we're different. So I will make sure that the testimony it's submitted in both languages. Good evening, everyone. My name is Antonio Alarcon, founder of Las Doñas Academy, who are members of this hospital too, a national organizer with the Center for Popular Democracy. It is an honor to stand here in support of Elmhurst Hospital, a pillar in our community and a place where healing meets hope. Elmhurst is more than just a medical facility. It is a sanctuary for countless families, especially immigrant and as some folks mentioned, right, trans community as well, who find not only quality healthcare, but also a welcoming and compassionate environment. Under the exceptional leadership of Helen Arteaga, Elmhurst Hospital has continued to embody the values of inclusion, equity, and unwavering dedication to those in need. Helen made history as the first woman and the first Hispanic to become the CEO of this hospital, of Elmhurst Hospital. Her journey from an immigrant family in Queens to leading one of the city's most vital healthcare institutions is an inspiration to all of us. She understands firsthand the struggles that many of us face, and because of her leadership, Elmhurst remains a safe haven where everyone is seen, heard, and cared for. And I will say it in Spanish because I want to make sure that my doñas understand, because they're being part of this as well. Para muchos inmigrantes, entrar en un hospital puede ser una experiencia desalentadora. Sin embargo, el Hospital Elmhurst ha fomentado una atmósfera en la que nuestra comunidad se siente abrazada, respetada y valorada. Desde servicios multilingües hasta atención culturalmente competente, esta institución garantiza que nadie se quede atrás, en un lugar donde el sueño estadounidense de oportunidad y equidad se extiende al derecho fundamental de todos, el derecho a la atención médica. La Academia de las Doñas nos orgullece de decir que hemos colaborado con el Hospital Elmhurst MetroPlus y obviamente con Clarita, que también nos ha apoyado con capacitación en salud mental, proporcionando recursos críticos y apoyo a nuestras comunidades. Al trabajar juntos estamos rompiendo las barreras para la atención de la salud mental, reduciendo el estigma y asegurando que los inmigrantes y los grupos marginados reciban la atención y el conocimiento que merecen. Esta asociación es un testimonio del poder de las soluciones impulsadas por la comunidad y de nuestro compromiso compartido para el bienestar. And I just want to say, also today we express our deepest gratitude to the doctors, nurses, and staff and leadership from Elmhurst Hospital. Your dedication and sacrifices do not go unnoticed, and our community stands with you in support and appreciation. Together, we will continue to uplift and strengthen this institution because when we stand united, we ensure that Elmhurst remains a beacon of hope and healing for generations to come. Thank you.
Thank you so much. Next speaker is Bill Soros, school principal at Newtown High School, and after that, Sylvia Mata.
Hello, everyone. I'm the new principal of Newtown High School. The previous principal was there for 32 years, John Ficalora. So I'm very honored to be here to speak to you all tonight. It is an honor to be here to celebrate the incredible partnership between Newtown High School and Elmhurst Hospital. Over the years, Elmhurst is more than just a healthcare provider in our community, has been a true partner in supporting our students, families, and educational programs. As a proud member of this community, I grew up in Queens. I still live in Queens. I live 15 minutes away in Astoria. And as a first-generation American, I understand firsthand the power of opportunity in education and manifesting the American dream. It was through public education that I have become a principal, and I want the same opportunities for our children at Newtown High School. So it is my deep belief that every student, regardless of background, should have the access to pathways that lead to rewarding careers, and that is the mission and vision of Newtown High School currently. Through our career technical education programs, we aim to provide students with the skills, knowledge, and real-world experiences that will empower them and to build successful futures. Elmhurst Hospital has played a critical role in this mission, helping to ensure the safety and accessibility of our school events. Atia Butler, thank you for inviting us today. She's the Director of Marketing here. And through their generous sponsorship last year, 50 of our students were able to go to the prom in Long Island, and that would not have been possible without Elmhurst Hospital. They have also supported our hiking club, where I think we're the only school in Queens, or in New York City at least, that has a hiking club. For the last 14 years, they've been going upstate, allowing our Queens students to experience that wonderful beauty of the outdoors. And this year, they've been providing us with coach buses, which has been great. Beyond these efforts, their contributions to our school toy drive, breast cancer donations that our PTA President, Melissa Castro, who joined me here tonight, was able to make tangible impacts on the lives of families in our community. So Elmhurst Hospital's dedication to our students' well-being extends far beyond academics. Their involvement in the suicide prevention and youth programs have helped foster crucial conversations about mental health and provide essential resources to our students. This is something, especially these days, our students struggle with anxiety. Their collaboration with our PTA to discuss subway surfing awareness, and also provides parents and students with life-saving information that they otherwise would not have been exposed to. So as we look to the future, we are eager to strengthen our partnership even further. Our goal at Newtown High School is to provide all students with a viable CTE pathways, as I mentioned. And this year, we're actually applying to our Future Ready program for diagnostic medicine and for pre-nursing. So we hope that Elmhurst will be a partner with us, an industry partner, making our students have mentorship, hands-on learning experiences, career days, internships, volunteer programs, so that they can learn these particular trades and also have a lucrative career path when they graduate. So we are incredibly grateful for Elmhurst Hospital and ongoing commitment to our school and community. And we look forward to expanding our partnerships in the future, and myself as principal as well. Thank you, everyone.
Thank you.
Thank you so much.
Thank you.
Thanks for your comments. Next speaker is Sylvia Mata, President of LULAC, League of United Latin American Citizens. And after that, Dr. Tamara, President. Sylvia's not here, or? Dr. Tamara, President, is that correct? Okay, great, thank you. Go ahead.
Not a medical doctor. Good evening, everyone. Good evening.
Evening.
It's been a long day dealing with these kids all day. I am also from high school. I am from the best high school for STEM in Queens, New York, and that is Health, Arts, Robotics, and Technology High School. And we have partnered with Queens Hospital. Thank you, Mr. Moore. Thank you, Cleon Edwards. We've partnered with them to have a program where our students can get familiar with the different careers. So we have a career day coming up at the hospital in March. So that'll be coming up. But what we do at our school, we have robotics, we have drone engineering. We actually have the first New York City drone engineering competition happening March 1st. We were on Pix 11 yesterday for that very conference that's coming up. We also have a visual arts program, and we have a medical assistant program. And this is where something so small is just asking. I was told as a child, a closed mouth does not get fed. And I simply wrote an email, and Mr. Moore responded to my email. And I felt like a celebrity had responded to me, because CEOs do not have time to answer, emails from people like me. He doesn't know me. He doesn't know me anything. But he took that email, and that is how the partnership was built. So I am very appreciative of just me being able to reach out and getting a response. And Mr. Edwards over there, Cleon Edwards over there, just connecting the dots and helping me to speak with different people at the hospital to make these events happen. So we are happy that our students will be able to get firsthand information from people who are in the field by going over to the hospital and visiting, and hopefully we'll build on that partnership to get more opportunities. So that's what we're looking forward to. And I thank you all for your presence and listening. Thanks.
Thank you.
Thank you so much for your comments. Next speaker is Coyote Ayatiwa, Principal at the Health Arts, Robotics, and Technology High School. Principal? The principal, Coyote Ayatiwa. Perfect. Okay. No worries. Thank you very much. Okay. Okay. So next speaker then is Anna Raghubir. Oh, also. Okay. Also, I was about to say. Okay. Sunshine Smith Williams, co-founder of Pink Panther Click. Okay. Nelson Ravel Jr., Prevention Coordinator for Elm Corps Youth and Adult Activities. Thank you so much. Great. And after that will be Hannah Joe. Great. Thank you.
Thank you very much. I thought I was going to be last, so. Good. Excuse me, I'm out of breath, but I've been sitting. I don't know why I'm out of breath. Okay, good evening, everyone, and thanks for having me. And also thank you for the speakers before me. My name is Nelson Ravel Jr. I am the Prevention Coordinator and Substance Abuse Counselor at Elm Corps Youth and Adult Activities, located at 108th Street and Northern Boulevard. Elm Corps is a Black-founded, Black-led, nonprofit multi-service agency that serves the entire lifespan. We are currently in our 60th, excuse me, these fonts are small. We're currently in our 60th year, and we are celebrating a gala in April 2025, shameless plug. Today, I want to talk about something that affects families, communities, and the future of our youth, which is drug prevention. Substance abuse doesn't just impact individuals. It affects loved ones, disrupts families, and challenges the stability of entire communities, including adding more burden to hospital systems. Excuse me, I'm sorry.
No worries.
Okay, good. But the good news is that prevention and support programs can make a real difference and ELMCOR is at the forefront of that effort. At ELMCOR, we believe that prevention is just as important as treatment. That's why we offer several programs designed to educate, support, and empower individuals before substance misuse becomes a problem. One of our key initiatives is our prevention coalition that's called QPCC, which stands for Queens Prevention Community Coalition, which brings together community members, local leaders, and organizations to raise awareness and develop strategies to reduce substance use, particularly alcohol in migrant people of color. That's our target population. Through education, advocacy, and outreach, we work to create a healthier and safer environment for everyone. Now, I want you guys to do something when you leave this meeting today. When you walk across the streets and you go to a corner bodega, right? I want you to check out the advertisement, right? All you're gonna see is alcohol. You're not gonna see juice, water. You see alcohol advertisement and you see it at kids' eye levels, children's eye level. You know, that's something that we want to do something about that, because we know that advertisement works. I wasn't planning to share this, but since I have a lot more time, sometime last year, this is why advertisement works, my personal experience. Sometime last year, someone vandalized my car, right? So my landlord calls me, listen, something happened to your car, come check it out. So I go downstairs and the back window is broken, right? So the first thing that popped into my head when I saw my window broken was Safe Life Repair, Safe Life Replace. The commercial popped in my head. And guess where I went? Safe Light, right? Because the advertisement works. Now, in that case, that was good for me. Now, what happens when we're coping with issues and problems and life struggles? What's going to pop into our children's head? The alcohol advertisement that they see everywhere, right? So please join our coalition to make a difference. We meet every last Thursday of the month virtually. If you want more information, I can share my business card. For parents now, we offer Active Parenting Program, which provides essential tools and guidance to help raise confident, responsible, drug-free children. We understand that parenting isn't easy, and this program helps caregivers strengthen communication, set clear expectations, and build strong family connections. If someone is struggling with substance use, ELMCOR provides also outpatient and residential treatment. Our outpatient services offer counseling and support allowing individuals to maintain their daily responsibilities, while our residential program provides a structured, supportive environment for those who need more intensive care.
Thank you so much. Would you wrap up and submit anything?
I didn't even notice. Thank you very much. Appreciate that. Lastly, prevention also comes in the form of counseling. ELMCOR is one of the few agencies that also provides prevention counseling, meaning that the person could receive counseling before the development of a substance use disorder. So if you guys want any information, I would love to make partnerships, maybe 100 partnerships today. Thank you very much for having me.
Thank you. Thank you. Thank you. Next speaker is Hannah Yo, from Health Policy and Programs Manager for the Minquan Center for Community Action. After that is Allison Brown. Thanks. Go ahead.
Thank you. Good evening. Thank you for having me. My name is Hannah. I'm Hannah Jo. I am a Queens resident. I'm also an immigrant, and I'm also a staff at a nonprofit in Queens, in Flushing, called Minquan Center for Community Action. We serve immigrants, New Yorkers, folks who speak primarily Korean, Chinese, Spanish, and all other languages. So I just want to speak on behalf of Mingwon Center and some of the collaborations we've had and some of the struggles our community members have. So when I first joined the organization in 2020, immediately partnered with NYC Care Program through connecting with Marielle Kress, who was the executive director at the time. And yeah, it was this wonderful partnership. Since then, we've referred around 300 community members to enroll in NYC Care. And in 2021, we had a community resource fair in the Murray Hill, Flushing area, and we had Health and Hospitals join us to provide COVID testing on site. 2022, they came and joined us with the Vax Van and provided COVID vaccines, free COVID vaccines. Last year, 2024, Health and Hospitals nurses and staff came and provided free blood glucose testing and blood pressure checks, which was all very much appreciated by our community members. A lot of those who are uninsured. And I wanted to also share a testimony, and more importantly than what I have to say, from one of our community members about her experience with a health condition. So I'll read her testimony. I'm Tina from New York. I'm a 53-year-old undocumented immigrant from Korea. I received NYC Care and an emergency Medicaid card last year with the help of Ms. Hannah Jo at the Mingwon Center. After that, I thought I would never go to the hospital and didn't even know where I placed my card, but on June 21st, I felt something was off with my health. I had severe coughing and shortness of breath, and even my voice changed. At first, I bought 2 days worth of cough medicine at the pharmacy and took it, but there was no improvement and I was still not feeling well. Working part-time, I couldn't even go to work. I asked someone else to work for me while I took medicine and rested at home. At around 2:30 a.m., I couldn't breathe properly and had trouble breathing even when I lay on my side or changed positions on both sides. If I sat down for a moment, it would be fine, but it was extremely tiring and I was extremely tired and afraid that I couldn't continue like this. So I called myself 911. In less than 10 minutes, an ambulance arrived and picked me up waiting outside the apartment. 2 staff from the ambulance arrived at the hospital quickly, took care of me. One went through the registration process while the other checked my chest with a stethoscope. I initially asked to go to Jacobi Hospital, but they directed me to North Central Bronx Hospital, which was close to my home. At the hospital, I did blood tests, x-rays, and even CT scans and communicated with the doctor through an interpreter. The test results showed no signs of abnormality, and even after a COVID test, the cause could not be found. The doctor recommended that I stay to check on my progress, so I rested 3 days in the hospital. I was discharged from the hospital, but I cried a lot and thought about what it would have been like if I living alone, hadn't been issued an NYC Care and emergency Medicaid card. Even in the process of acquiring health insurance is a bit cumbersome and difficult. I hope that many people like me will receive help from Mingwon Center to stay healthy. So I just wanted to say that I'm really happy and grateful for the partnership and for NYC Care and for support of Health and Hospitals to our immigrant population. And in light of everything that's going on right now, I really hope that we can continue to collaborate and support access to healthcare to our immigrant community members, support and fight for the healthcare access for everyone in the community. So thank you very much.
Thank you very much for your comments. Thanks. Next speaker is Allison Brown, Senior Community School Director at PS 14Q.
Yes.
And then after that, Tata Cato.
Hello, thank you for having me tonight. So I'm the Community School Director at PS 14 in Corona, close to here. I would like to express my gratitude to Elmhurst for being such a strong, reliable partner to local public elementary schools. Since 2019, I've worked in Corona, first at PS 19 and now at PS 14. Between the two schools, close to 3,000 students are served, many of whom were born at Elmhurst and whose families rely heavily on the hospital. Elmhurst has been one of our most reliable community partners, donating turkeys every year to 100 families, at least, sometimes more, providing free services at our health fairs, contributing school supplies for our students in temporary housing, and most recently hosting a field trip for kids from PS 19 and PS 14's Green Team students. During this trip, the Green Team student members learned about connections between environmental conditions and health outcomes, and they got to hear directly from Elmhurst Green Team about how they're making a difference, making Elmhurst more environmentally progressive, as well as advocating for a healthier community. Afterwards, the students got a personal tour of the green market with Grow NYC, and they even got some fresh produce to take home to their families. They met in here and they were treated like, VIP from the start. They were very excited. Forming a strong partnership between schools and hospitals is beneficial on so many levels. Having a point person at the hospital has been invaluable for me during my work in the community. For example, just last week, a parent at my school caught wind of the fake news going around that Elmhurst was and other local hospitals were collaborating with ICE to detain people in waiting areas who didn't have ID. I immediately called Atia Butler, who assured me that, of course, this was not true, and passed on information from the PR campaign about the hospital's campaign to combat this type of misinformation. So I was then able to share that information directly with our parents, which has so many ripple effects that you guys probably would never see, but schools are so in touch with the community and they know what's going on the ground, and having that connection is just invaluable. After forming such great trust and partnership over the years, we are able to draw on that during these uncertain times. And we look forward to many more years of partnership with Elmhurst. We appreciate how responsive, kind, and effective their staff have all been when partnering with local schools. Thank you.
Thank you so much. Next speaker is Kata Kato, founder and director of Queens World Film Festival, and after that, Maria Morales.
Hello, and thank you for having me here, and thank you for making such a valiant effort on my name. It's absolutely correct. Katha Kato. Yes, thank you so much. It's almost as if we knew each other. And thank you to everybody else for being here and for your patience and your dedication to our community. My name is Katha Kato. I am the founding executive director of the Queens World Film Festival. I'm not an expert on anything. I can only share my experience. As a 5-time cancer survivor and a member of the World Trade Center survivor community, I've done my time at hospitals in several different zip codes across New York City. So I know firsthand how everyone works on that other end of the needle. And I recognize the challenges that this hospital is up against, and many of you have spoken about that. I just wanted to share that we are proud partners and thankful for New York City Health and Hospitals, Elmhurst. So when the pandemic hit, like everybody else, we were immediately homebound. And for the first time in over 10 years, we were able to not be in a hurry, and we decided to start to walk. And we walked in our neighborhoods and we saw very few people, except scores and scores of people in scrubs. It was my first time of really understanding that my neighbors were keeping my neighbors alive. I was completely overwhelmed. One day we decided to follow them and we ended up here. Sadly, I was born in Yuma, Arizona. I'm not a Queens native. I've been here for 35 years, but I did not know about the hospital. So almost every day we would stroll by here, and what we saw is just unimaginable. People walking into the building with such purpose, with such energy, and people staggering out. So I can't say broken, but I don't know how they weren't. So in 2021, we contacted the national treasure, Atia Butler, and she graciously allowed Queens World Film Festival to honor the hospital and all of the staff here as our 2021 Spirit of Queens honorees. We were able to hand over an $8,000 check, which was 1/3 of our ticket sales that year. And then Atia and I were able to curate a year's worth of festival films that could screen at lunch for this incredible crew here, so that it would extend the festival life of the films and also give some respite to these incredible human beings. Currently, we're speaking with Atia about including a blood pressure table at our upcoming events. I don't know about anybody else in this room, but since January 1st, I find checking my blood pressure regularly quite healthy. So this community is varied, It is dynamic, and many of us are a wee bit broken, discouraged, in pain, and sometimes just really in trouble. And so all I can say is thank God for this hospital. Thank you.
Thank you. Next speaker is Maria Morales, Community Leader for CRECE. Okay. EE. Yeah, could I say? Thank you. Could I say? Are you Maria Morales? Okay, go right ahead. Oh, yes, yes, I see you. I
Yeah,
see you.
okay.
That's fine. Go ahead.
Well, good evening, everyone. Buenas noches a todos. I hope you're all doing well. First and foremost, thank you so much for allowing us to come here and to speak to you all. My name is Maria Deakis. I'm the director of CRECE Family Enrichment Center, a new community space coming to the heart of Elmhurst and Corona. We're very excited to be able to open up this year. It's a 2-floor facility, 4,500 square feet, where we're going to be offering all kinds of free programming to our families and community. I am here representing CRECE, but I'm also here as a community member. I grew up in Corona, and I've been here all my life. I'm a Queens native. This hospital has been a part of my life as well for many years. And I have a few points that my community asked me to speak on today, and I want to be faithful to that. First and foremost, I just want to say a big shout out and a big thanks to this hospital for being a beacon of hope, a pillar for so many in the community. Thank you so much, Helen, for your leadership. I've been in this city for about 25 years now, and I have seen the change from, back in the day, we would truly kid around about not coming to this hospital. And now this is a place where we come when we're not okay. So that speaks a lot. We have recently seen a lot of the headlines around gender affirming care. That has caused a lot of anxiety, a lot of angst amongst our community members. And we are really appreciative of the position that Elmhurst Hospital has in continuing to provide gender affirming care. We thank you, Dr. Mitchell, for talking about the stats, and we hope that this year we'll continue to speak on all the ways that we've been providing this gender affirming care, because we understand that gender affirming care is healthcare for so many. We also want to say that we are thankful for the leadership in relation to what's going on with ICE. As a community member, I can say this has been extremely, extremely demoralizing and terrifying to our community members, to the point where people don't want to go to the hospital sometimes. They don't want to take their children to school. And it's important that we are loud about our position so that our families continue to seek the healthcare that they need. I encourage the hospital that any time that they're going to send out a PR campaign or talk about something in relation to immigration, to ICE, to please do it in Spanish as well. That is so important. For example, there was misinformation going around a couple of weeks ago about how ICE was coming into the Elmhurst Hospital, and it was a post that was circulated all around Facebook and Instagram, and I had so many families reaching out, terrified, didn't know what to do. Thankfully, with Clara, she reached out immediately and said, this is false news, fake news, this is not happening. And we were able to, let our community know. But in the future, for us, public advocates and people that are, talking to families face to face, having something to show, like a post from Elmhurst Hospital in Spanish, can be very comforting to our community. And so I encourage the Elmhurst Hospital to think about that. And then finally, also, being, I say loud, but being very intentional about our position in this situation, whether, talking about a safety protocol, what is the safety protocol around if ICE were to come into the hospital, and that's what our community is asking, what is the position of the hospital? What were to happen? How can our constituents, our communities continue to feel safe coming to the hospital? And if there's any way that we can disseminate that information, right? A post, not only on social media, but maybe a memo that we can circulate to the community, some way that we can show that the Elmhurst Hospital continues to support the community regardless of their immigration status. That is, irrelevant when it comes to seeking the care that they need. But it's very helpful for us, teachers, community leaders, stakeholders, to be able to have something to show our community and say, this is how the Elmhurst Hospital is positioning themselves during this time. And yeah, that's pretty much it. Thank you so much.
Thank you very much. Next speaker is Joanna Pineda, Community Ambassador for ECP. Okay, she left. AJ Yusuf, Community Relations Specialist for Metro Plus. Oh, okay, all right, thank you. Next speaker, we're back to Johanna Pineda. Okay. Diane Lee, social worker at Elmhurst. And after that will be Angel Kalisaya.
Hello, my name is Diane Lee. I've been a social worker here for 7 years, and I've been running with Queens Distance Runners for 4 years. I wanted to let everyone know about a race that we have coming up this summer. It's the Elmhurst Mile. Queens Distance is all about community, being active, and staying healthy together. The Elmhurst Mile, the proceeds are going to a few different organizations, including our hospital. If you're interested in running with us or racing, you can find more details on the website, Instagram, and Facebook. Thank you.
Thank you.
Great, thank you so much. Next speaker is Angel Kalisaya, Director of Operations at Neighborhood Housing. And after that, Aaron Stern.
So, hi, good evening. My name is Angela Kalisaya.
Angela, sorry.
So I wrote a whole long thing. Because I grew up within the south side of the hospital, in the 10 blocks behind us. I have lived in this neighborhood for a little over 30 years or so. And it when I think about Elmhurst and I think about my home, and it involves Elmhurst Hospital. It involves my community. It involves the family, my neighbors. And so that's why this was when my executive director, Yoselin Henao Estrella, had asked me to come instead of her. It was definitely a beautiful opportunity for me to be able to express and share, the gratitude that comes to having a space like this in this neighborhood and having grown up here. Yoselin sends her extensive regards and thank you to the leadership of Helen, the board, and the entire facility of Elmhurst Hospital. I will share one, I wrote a whole long thing, but I think nothing will really brings to light what the hospital means and the union in which my journey has meshed Neighborhood Housing Services of Queens, CDC, along with my journey here at Elmhurst Hospital. Last year, New York City decided to open up this long-awaited Section 8 wait list. Many folks have been waiting for this for over 10, 15 plus years. And then, of course, the city then went and said, you will have 1 week for everyone in New York City to apply for this wait list. And so as a nonprofit organization, this was our Super Bowl, because one of the main programs for that we provide is affordable housing for here, for this community of Queens in New York. And so our team, my team of NHS, boom, on the ground, setting up, calling everyone and all our partners, because this is the time when we needed to be there for our folks. Let's see, it was each day we managed to divvy up the borough into sections. So we would be visiting 3 to 4 locations a day. And we are a very small team. So that is logistically, it was intense. So here, we came here on June 6th and we were able to serve more than 30 families. And it wouldn't have been without our partnership here at the hospital, the people here, the leadership. And if that doesn't speak to what Elmhurst Hospital is for this community, you know, so definitely much gratitude as a resident, as a neighbor, and as a community partner with Neighborhood Housing Service, because we would not be able to serve those that we serve without partnerships like Elmhurst Hospital. Thank you.
Thank you so much. I think our last speaker of the evening is Aaron Stern, a physician at Elmhurst Hospital Center. Dr. Stern is here. And if not, we had our last speaker. Thank you so much. All right, well, that concludes our list of speakers. Thank you so much all for coming and staying, and get home safely. Bye-bye.